My name is Vanessa Ferguson, and I'm a PhD candidate in the Health Policy and Equity program at York University. There's the use of artificial intelligence to treat and manage sickle cell disease, which is a genetic blood disorder that primarily affects Black and racialized communities. I'm looking to examine how some of these AI tools are being used, how they're being designed, and how they're being represented in policy to see whether or not they're actually going to address the needs of sickle cell patients, specifically in Canada. So basically, in simple terms, I'm trying to study how AI can either reproduce existing health equalities or actually address existing health inequities and inequalities in healthcare. As not only sickle cell affects my family, but it's very under-researched and understudied. So when I was doing my master's research on sickle cell, all my literature was based on American literature, and there's hardly any Canadian literature talking about sickle cell disease and the inequalities in sickle cell disease, and moreover, the use of AI to treat and manage sickle cell disease. I also noticed that a lot of AI, health AI, is described as innovative and transformative, but oftentimes recipients of these technologies are rarely consulted and actually lack a basic understanding of what these technologies can even do for them. So I'm interested in trying to bridge some of these knowledge gaps and power imbalances, and hopefully trying to promote equity and, thinking about different and ethical ways to include some of these marginalized communities in piloting tools that would actually be useful for them. My favorite part about my research is really just learning a lot of new things, especially revolving around the AI space. AI is constantly evolving, so as time goes on, there's always new use cases being developed in different ways to try and promote health equity or promote innovation. So it's really interesting trying to understand a lot of those pieces. I also really enjoy charting and describing and also advocating for the sickle cell community. Like I mentioned, people with sickle cell, they're underrepresented in research. We're underrepresented in even getting funding for research. So I think I really love advocating for the sickle cell community and just bringing awareness to the challenges that those with sickle cell face. So I think my research will first and foremost help bring awareness to sickle cell disease. Like I mentioned, it's under research, it's underfunded. A lot of people, don't even know what sickle cell disease is. They don't know that racism is closely associated with the disease and disease outcomes. Beyond that, I'm looking to kind of redefine what ethical AI or innovative AI actually really means in the real world, and also trying to account for lived experiences, specifically of Black and racialized communities, and how we can actually promote ethical AI in those contexts. I'm also looking to contribute to policy conversations by, advocating for sickle cell patients and including them in these conversations, since there is a lack of sickle cell policy globally, but specifically in Canada. So I'm really hoping to just bring awareness to the fact that sickle cell disease is something that Canadians, Canadian government, policy, healthcare needs to pay attention to.